All right, thank you. Well, it is time to ask the vet specialists, and this month we're talking about tracheal and bronchial collapse in dogs. My mic is on. Is my mic? It was on. Are we okay? Yeah. I'm having a mic. Okay. Dr. Ingrid Strader, animal cardiologist of Alabama, and Dr. Jerome Williams with Red Mountain Animal Clinic are here this morning. Good morning.
Good morning.
And I'm going to ask my producer Kelly if we can, you brought this sweet baby with you, and we can get that set up, and I'll tell you who this is. This is her golden retriever. I'm in love. And she's expecting puppies any day now, right?
Any day. Next 3 to 5 days, I would say.
All right, well, we're going to see here in just a second. But this, boy, what a long name, but very serious issue, I would assume?
Yes, it is serious. However, in most cases, it is not life-threatening and it's not infectious. So,
okay, so what's happening?
I'm encountering it a lot during my cardiology practice because it makes dogs cough.
Okay.
And luckily, it is usually a much better diagnosis than saying your dog is coughing from congestive heart failure. It is only tracheal or bronchial collapse.
Veterinarians like myself misdiagnosing it sometimes before we send them to you?
Yes, we all do, because it is difficult to pinpoint.
How prevalent is it?
It is very prevalent, especially in the smaller breed dogs, especially in the aging smaller breed dogs that often also have a heart murmur, of course, which is why
they can be related. Can you recall any that you've seen that ended up being that?
Oh, yes.
So
yes,
what did you see initially when they brought them in?
Many of these are also those with the short muzzle, the little smug face type dogs. And you get this cough that you just can't seem to control. And I've seen cases to her assuming it was cardiac, when in fact it was trachea.
So is it a real cough? I know we have the Boston that we kept was a rescue, and it has that like reverse.
The reverse sneeze. I don't want to do this on air, but it's an interesting sound.
But that is something totally different.
That is often from an elongated soft palate, and they're a little bit related. You know, it's cartilage, and it continues to grow, and they make this interesting sound.
Yeah, they do. And you sound like they can't breathe, really.
Right, and it's very scary.
Yeah.
And the cough often is too, the tracheal cough is often very scary as well. Often happens at night because as the dogs shift, they wake up and then they start coughing, and then they cough even more. And there's my mama.
That's your sweet. What's her name again?
Nova.
This is Nova, and Nova is due to give birth to some puppies in just a few days. Yes. So she's tired.
She's tired. She's very pregnant, but she's doing very good. She's doing good.
We had her in the green room, and she's just very loving right now, but getting ready to give birth to some puppies. Yes, I'm talking about you, sweetheart.
Yeah, you my love.
All right. So what should folks be? Obviously, if your dog is doing something that's different than what they normally do, come check with you first.
Yes, I check with your regular veterinarian first. Now we're talking about trachea, bronchial collapse. We're talking about the windpipe, for those of our viewers that don't know exactly what trachea is. And yes, go to see your regular veterinarian, and they'll work the case up, and if they need additional help, they'll see.
So has it literally collapsed?
Yes, there are different degrees of it, and it is a progressive issue. And
so they can have variations of what we're seeing on the screen.
Absolutely, absolutely, and hopefully I will never encounter the one on the right.
I would imagine that is very.
No, that would be life-threatening.
That would be life-threatening.
Yes,
yeah.
absolutely.
So what do you do as we wrap up? If you come in, you discover this is it? What do you do?
Well, first off, I reassure them that it is luckily not congestive heart failure cough, which is really worse. And then we talk about how severe is the cough. Does it really disturb you? Does it really disturb the dog a lot or not? And you can have some medications to calm it down as an anti-inflammatory. There's also some stenting things that you can do, but none of them are really perfect.
All right. Well, it's just a good idea to keep an eye on things, and we are completely down now, tired and sleeping. And I don't blame you, sweet girl.
Very comfortable.
It's hard being a mama.
And almost ready.
All right, almost ready. Hey, thank you both. It's a very important thing to talk about and remind folks about. We'll take a break. We'll be right back. Just don't wake her, let her sleep.